once appropriately vaccinated. So this is an initiative from Kedla Pharmaceuticals through its innovation to serve the society to the mankind. The topic of this webinar: dose reduction strategy in rabies management, role in novel vaccine. So, dear doctor, rabies is the world first 3-dose anti-rabies vaccine. With the great pride, we would like to inform you that rabies has successfully completed 1 year of your launch, and with more than 40,000 annual wide victims are vaccinated and 100% compliance was recorded. So there is no case of ADRS was registered. So with this is my honor to introduce Dr. Mithun Pal, Gauripur, Doctor of Gauripur. And now I like to request Sir to take the talk about later. We would like to question answer session. So if anybody want to ask anything, so chat box is open. They can drop their question into chat box. So sir, please start, sir.
Thank you, everybody. My name is Dr. Mithun Pal. I am from Gauripur. And thank you, Cadila, for arranging such a wonderful session. And thank you for giving me an opportunity to talk about rabies or recombinant rabies vaccine. Rabies, a public health challenge in India. Globally, is almost 59,000 human deaths annually, highest in India. And India had 20,000 human deaths a year from rabies, accounting for 60% of the rabies deaths in Asia and 35% globally. 91% deaths in India occurred in rural areas also. Every 9 minutes, a rabies patient dies. And current management, the management of wound of any bite is local wound treatment like first aid. Then afterwards, active immunization via vaccine and passive immunization via rabies immunoglobulin. Previously, 5-dose ASCENT regime intramuscular was applied also, and we used to give in our hospital or clinic also the 5-day regime. The dose was 0, 3, 7, 14, and 28 days. And in category 1, 2, and 3, and in category 3 and 4, we also used to give rabies immunoglobulin surrounding the lacerated wound also. Rabies post-exposure prophylaxis is also to maintain the hygiene of the area. Current challenges in the post-exposure prophylaxis: non-compliance. Current rabies vaccines are cell culture vaccine. Inactivated vaccines are more than 50 years old technology, and it is inconsistency in potency. Stability, also a problem. Availability, short supply, and adverse event of that cell culture vaccine. Slide, please. Next slide. Compliance, anti-rabies vaccine. Compliant, who received the full course of anti-rabies vaccine, that is the scheduled dose of anti-rabies vaccine on the recommended dates. Delayed compliant, who completed the scheduled dose of anti-rabies vaccine within 60 days, but deviated from the scheduled regimen. And dropout or non-compliant are those person or patients who had taken at least 1 dose of anti-rabies vaccine after animal bite, but not completed all the scheduled doses. Next slide. Compliance to post-exposure prophylaxis among animal bite patients, a hospital-based epidemiological study at Safdarjung Hospital, New Delhi. 360 number of animal bite patients are studied. A pre-designed, pre-tested structural questionnaire was administered by the interview technique. 53% were non-compliant to the full course of anti-rabies vaccine. At Municipal Corporation Hospital, Bangalore, total 215 animal bite patients were studied, and one of the rabies vaccine administered intramuscularly on 0, 3, 7, 14, and 28 days as PEP, post-exposure prophylaxis, also measures constraints for compliance to complete course. The compliance rate for intermuscular vaccine is also the constants for compliance to complete course of anti-rabies vaccine are interfering with school timing 11%, distance from the hospital is 11%, cost incurred 13%, forgotten dates is almost very large, 18% cases. They all always forgot the dose regimen. The major constant for compliance to complete anti-rabies vaccine was loss of wages, 47%. Okay, next slide. Then evolution of the rabies vaccine. Previously in 1885, live attenuated vaccine from spinal cord, non-standardized dried preparation. Up to 31 injection was used to given that time. Then afterward in 1911, inactivated vaccine was introduced, minimal neural content liquid preparation, 14 injection of each of 0.5 ml daily. Then cell culture vaccine, inactivated vaccine in 1976 was introduced, and standardized immunogenicity lyophilized, 5 injection, 0.5 ml to 1 ml. The dose was 0, 3, 7, 14, and 21 days. Non-compliance lead to evolution in treatment of regime from 31 dose to 5 dose and still on. Next slide. Meeting the unmet medical need, introducing the novel vaccine with simple and shorter regimen. Novel 3-dose recombinant rabies G protein vaccine. And the first protein subunit vaccine prepared by VLP platform technology, virus-like particle. First vaccine with 3-dose intramuscular regimen 0, 3, and 7 dose. And better compliance due to easy to flow regimen and less visit. And convenience, ready to use, no reconstitution needed. Novel 3-dose vaccine is like that. And virus-like particle technology, vaccine are derived from native virus. And here is the clinical study. Phase 3 trial was also conducted. Safety and immunogenicity of a novel 3-dose vaccine recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization. A randomized comparator controlled multicenter phase 3 clinical study also shows that. Next slide. Phase 3 study. The rabies vaccine is an intramuscular regimen. It is G protein based vaccine, and the dose regimen is 0, 3, and 7 days as compared to previous intramuscular regimen 0, 3, 7, 14, and 28 days. And the study subject was a total 800. Okay, next slide. Study conclusion. Novel 3-dose was non-inferior to reference vaccine, less adverse effect compared to reference vaccine. Novel 3-dose was found to be safe and immunogenic and was comparable to 5-dose WHO pre-qualified vaccine. Next slide. Thank you very much. Thank you.
Thank you, sir. Thank you giving a precious and valuable time. So thank you so much, doctor, for your informative talk. We would appreciate your effort, but last but not the least, we would like to inform you that Travis has won the prestigious award in innovation category, that is India Pharma Award and Golden Globe Award. So thank you giving a precious time. So, doctor,
Thank you very much. Thank you.